And good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently just about 7 o'clock, not quite, on August 3rd, which is a Monday here. And I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, did you know it's Grab Some Nuts Day? I'll get to that in just a few minutes. What we do since early March when we started doing these things is to touch base on the COVID cases, because the COVID situation is the single driver that's pushing everything for the last 7 months at least. Right now, current COVID cases are at 4,698,000. 4,698,000 COVID cases were diagnosed in the U.S. in the last 7 months. That's another 157,000 just over the weekend since we spoke last on Friday. Now, for the total number of cases, we're still looking at basically 30% have recovered, and basically maybe a 3% death rate. So if you get COVID, you get about a 3% chance of dying. And right now, the way they've got things reported, you've got about a 30% chance of recovery. So that leaves 70% that we don't know what's going on with just yet. There's a problem in the reporting situation. Now, the deaths right now are at 155,191. 155,191 people have died. Okay, another 22,269 of them have died just over the weekend since we spoke on Friday. Now, California still has the #1 spot right now. They took over about 3 weeks ago from New York. California's numbers are pretty high. 512,000, almost 513,000 people have been diagnosed in California. Their deaths right now are at 9,400. Okay. It's just not happy. Wherever you go, it's just not happy. Florida's got the #2 spot. Okay. Texas is at #3. New York's at #4. They've dropped down from where they were originally for quite a while. Georgia's at #5. Illinois, surprisingly, just pushed up to #6, okay, over the weekend. New Jersey at #9. Arizona is still at #8. North Carolina is at #9. And Louisiana now made the top 10. Okay. We're 7 months into this, folks, and it seems it's more out of control now than it was when we got started. COVID-19 deaths are rising after weeks of, record-breaking new cases and hospitalizations. Okay, and now the world's going to look back and wonder. They're currently wondering right now, what the hell's wrong with the U.S.? Okay, we were once the most powerful nation in the world, and how the hell could we get this so wrong? How can this be so out of control? But it is. Okay, right now this epidemic is totally out of control, and it's out of control mostly because of our own behavior, according to William Haseline. Okay, he's the chairman and president of Access Health, okay, International. Now, people, according to him, have not taken consistent warnings of health officials seriously. I wonder why that might be. Okay, when you get mixed messaging across the board. Okay, the scientists are saying one thing, and the politicians are saying something different. No wonder why people don't take anybody's word at this point in time. Now, what's happening is they're gathering in private and public spaces, okay, without adequate protection. Okay, and totally ignoring the advice of the scientists. At least 30 states suffered higher rates of new deaths this past week compared to the previous week. In 12 of those states, the increase in deaths was at least 50%. Washington, Idaho, Montana, South Dakota, Texas, Mississippi, Michigan, Ohio, Maine, Virginia, West Virginia, and Alaska. And positivity rates for the tests, a real indicator of how rampant the actual spread of the disease actually is, remain stubbornly high in more than 30 states right now. He says it's not that complicated. Okay? If American schools want to open safely and reopen the economy to improve, okay, they must get serious about personal responsibilities. And this is what the health experts have to say. The CDC forecasts that another 19,000 deaths could happen between now and the next 20 days. Another 19,000 people could die in the next 20 days, according to CDC forecasts. You have to do more than just wear a mask and keep social distancing. You have to minimize your contact as with many other people as possible, as according to the Haseline. Again, this guy's in charge of a healthcare system. He might have some clue as to what the hell he's talking about. And he says, it's not that complicated. Okay. And if you have to do the work, if you have to go to work, that's okay. Just make certain that the workplace is safe and you can work there safely at a distance. Keeping a safe work environment and reducing your contact with others are among the two most important basic things that you can do, in addition to wearing masks and keeping your 6-foot distance. It's according to Haseline. Now, what used to be an urban problem is really now spread to rural communities. It's extraordinarily widespread, according to Dr. Birx. So everybody who lives in a rural area, you are not immune to or are you protected from the virus? And that's why we keep saying, no matter where you live in America, you need to wear a mask and social distance. Now, 30 states have paused their opening plans or imposed new restrictions on coronavirus, okay, because it remains totally out of control right now. And with growing evidence that face masks help, okay, at least 39 states have ordered some kind of mask order to be put in place. Yet many people aren't wearing masks. They aren't social distancing. We're 7 months into this right now. Okay, there's still no sign of a federal pandemic response. Okay, we're seeing rises in lots of states, and there's still a push from the administration about reopening schools and colleges in the midst of everything that's going on right now. That's only going to significantly compound the problem. Now, one school district opens, okay, 260 employees infected or exposed. In Gwinnett County in Georgia, where some parents protested in favor of in-person classes, at least 260 district employees tested positive for the virus or were in contact with someone who was infected. And that's according to the district spokeswoman. Now, the announcement just came days after teachers returned to classrooms for in-person pre-planning, because teachers generally go back about a week ahead of time and do all their setup and whatever additional classroom training they need at that point in time to keep them up on what's going on. Now, across the country, some students have already tested positive as the school year begins. In Greenfield Central Junior High in Indiana, a student tested positive on the first day of class, promoting the school officials at that point in time to isolate the child and start tracking whoever they might have come in close contact with. Now, in Mississippi, a high school student tested positive during the first week of classes, okay, in Corinth School District. That's what they had to say. In-person classes came after the CDC guidelines were laid out, reasons for reopening the schools. And even though it said places with significant uncontrolled transmission of the virus should really consider keeping school buildings, okay, closed. No one's listening, folks. The guidelines said children don't suffer much from coronavirus, but suffer from being out of school. Well, that's a little shaky when you get it. CDC guidelines also said that children are less likely to spread the virus than adults. But research suggests totally opposite things of that. Monday, Florida reported the deaths of 2 more minors from COVID-19 complications. At least 7 children between age 5 and 17 have died from COVID in Florida already. And that's according to the state's health department. In Florida, Miami-Dade County, one of the hardest hit places in the country, the superintendent said that students will continue virtual learning until at least October. Now, this is a quote. I want to be very clear. What we are seeing today is different from March and April. That's according to Dr. Birx. Okay. This is extraordinarily widespread. This epidemic right now is different, and it's both in rural and in urban areas. After falling for months, COVID-19 hospitalizations in the U.S. are nearing April's peak. In the past month, the U.S. has seen the highest number of new COVID cases since the pandemic actually began. The positivity rate increasing 32 states. Record high hospitalizations were deaths in several states. 10 days with more than 1,000 new COVID cases, new COVID deaths actually. Now the race is on to try and rein in COVID before more classrooms reopen and before more states might have to shut down again. Almost 2 million cases in 1 month. Almost 2 million new cases in just 1 month. July saw the biggest number of new cases in any month since the pandemic actually began, with more than 1.9 million new cases. And that's just not due to testing. I don't care how you cut it, it's just not due to testing. While the number of test performed has increased, the positivity rate has also increased. That means that a larger percentage of the tests actually performed turned out to be positive. As of Sunday, 32 states had higher test positivity rates over the last week compared to the prior week, suggesting increasing transmission. While some states' numbers are starting to improve, several states have recently endured their highest numbers of COVID cases and hospitalizations or deaths. Now, those two metrics you can't attribute to increased testing. Hospitalization and death, they come afterwards. Now, according to a Florida paper, he said, "We're dying here." Okay, that's what a Florida newspaper told the governor, urging a statewide mask mandate. They said that last Friday, I believe. Florida broke its daily record for COVID-19 deaths every day for 4 days in a row. On Friday, the state reported 257 additional deaths, surpassing the previous record of 253 deaths on Thursday. Now, last Wednesday, California reported 197 deaths, its highest number of coronavirus deaths in a single day. That shattered their previous record of 159 set just a week earlier. Last Tuesday, North Carolina reported a record number of 1,244 COVID hospitalizations. Texas broke its hospitalization record twice in 2 days. On July 21, Lone Star State had 10,848 patients. The next day, it jumped to 10,893 hospitalized patients. Texas also reported 197 deaths on July 23rd, the highest death roll rate since the pandemic actually began. Arizona reported 147 deaths on July 18, its highest daily number of COVID deaths. Tennessee reported 37 deaths on July 23rd, its highest number of deaths in a single day. Now, you wonder, why are these resurgences happening? Now, some medical experts say that, the states reopened too early, far short of meeting national guidelines on reopening. Others point to a lack of personal responsibility by many Americans, such as still failing to wear a mask or ignoring social distancing after the states actually reopened. Now, imagine a death toll equal to 9/11 attacks times 50. That's what you're seeing right now in the U.S. with the COVID cases. Now, according to William Hassline, there are three or four kinds of epidemics, that are fueling the spread. Now, the chairman, Hassline, he said they include young people who are socializing or actually ignoring physical distancing, essential workers who are in frequent contact with members of the public, people who live in crowded living conditions, and people in nursing homes or correctional facilities where the virus can really easily spread. But there's one other one which I'm worried about, which is the schools. That's what Hassline said. Again, he's in charge of a healthcare system. The latest data shows that children under 5 have 10 to 100% times as much virus in their nose compared with older children and adults. Is there any good news anywhere? Yes. Some states have decreasing rates of infection, decreasing hospitalizations, and decreasing deaths, and are paving way for full economic reopenings. The most successful states mandated face masks early, started reopening later than the other states, and found innovative ways to fight the virus. And while the U.S. is still struggling with testing shortages and delays, it makes it really difficult to isolate those infected. Many steps need to be shut down. Many states need to be shut down, basically, because it's so out of control at this point in time. Now, two of the most important steps right now are social distancing and wearing a face mask when you might come in contact with others. And that's what Anthony Fauci said. It's not rocket science, is what he said. Okay, if we all did, both uniformly, I believe that we could turn things around. That's what he said on CNN on Sunday, I believe. Now, if you want to open the economy, it's really, really simple, folks. It really is simple. Everyone needs just to wear a face mask and social distance. If everyone just did that, wear face mask and social distance, the country would be close to back to normal in just a matter of months. And as more and more people get infected with COVID, and it reaches in all areas where all the non-believers live, more people will soon know that, as they know that someone has COVID, that it happens. And it's going to happen to almost everybody. But you don't believe that until you actually know someone who's actually been affected. There are still people to this day, less than an hour ago, still posting idiot trash on Facebook. That it's all conspiracy. The numbers they're all overblown. They're over-reporting numbers. They're all from nursing homes. The excuses are off the wall. People are going to realize at some point, doctors, nurses, researchers were right all along. To this day, they're still denying basic science. And they deny the numbers and they twist the studies. And they're quoting statements from 5 years ago, why it's still just a conspiracy. And right now, we're in the middle of election season too. And the president can't answer the basic question, in any good way. Are you better off today than you were before he became president? So instead of running on his policies and accomplishments, all we hear right now is diversion and his attempts to delegitimize the election. That's all you see. And you step back and look at it, that's what happens. He's denied the science. He's denied everybody. Whatever he thought he was doing, he hasn't done anything at this point in time. And everybody in this country is worse off than they are, than they were 3.5, 4 years ago. Except if you're in big business, or you're one of his friends, and then you're doing just fine because you're getting a real big piece of the pie right now. Everybody else is hanging on by their thumbnails. And that brings me to the question for today. Did you know it's Grab Some Nuts Day? Your workday by now is already finished. How did it go? Yes, it's Monday. So why wouldn't it be Grab Some Nuts Day? We're just having one crazy week after the next. Hopefully you got caught up on your projects on Saturday. And on Sunday, hopefully you turn things off and you get some quiet time. Some people dread Mondays. Others see them as a new beginning. Either way, some crazier group of them decided that today, August 3rd, was going to be Grab Some Nuts Day. And it must have caught on to some degree. I'm easy. I really am. I'm always up for some type of celebration, even if it's a little minor one like today. It's always cute. They give you something external to smile about for a while. And some external stimulation is sort of nice every now and then. However, if you stay focused on what's really important to you, your longer-term life goals, you've always got that internal thing going that makes you smile. So grab a handful of your favorite nuts today and smile. You already started off your week. You know that no matter what crazy things may or probably will happen, you're going to stay focused on that longer-term life goal, and you'll be able to keep smiling. When you do that, it drives them crazy. They don't know what to do when you keep smiling. They really don't know what to do. So I'm Dr. Fred Rouse, the Real Money Doctor. My only goal is to help you to get, protect, and enjoy your money, your life, and your retirement. When you're ready to start doing something about your retirement, so you don't have to worry about ever working again, go to my site, drrousenow.com. Take a peek in. We'll see if I can't help you get that life and get to enjoy your retirement. For now, I appreciate spending some time with you tonight. I look forward to spending a little bit more time with you tomorrow around 7 o'clock. Thank you.